Dr Ros Taylor is a palliative care doctor and clinical director of Hospice UK. Good evening to you, Ros.
Good evening.
We hear an awful lot about what should happen, and people are saying more investment now might give us better palliative care in hospitals in 2020. But what realistically can happen now to make things better soon?
That's a really good question. And as a doctor, having worked in hospices for 20 years, and now in a hospital at the Royal Marsden, I can see that good palliative care, good end-of-life care is really possible in a very acute, busy setting. And I think the key is supporting doctors and nurses in those difficult conversations. I think palliative care support is vital, and it does need to be face-to-face because people die 9 to 5, they also die overnight, and they die at weekends.
Is it about throwing more money at doctors? I mean, because junior doctors are engrossed in their own personal fight at the moment now with the government. Is it about attracting more of them to the job, or is it about being smarter about the way jobs are being done?
Junior doctors are absolutely pivotal because they're in the front line, and they often are the people who are having those conversations. But what we've seen from this latest audit is that key conversations are just left too late in people's lives, often the last day or so. And I guess what we've learned from other research is that the earlier we talk about difficult things after diagnosis, the more likely it is that you will end your days out of hospital where you want to be.
Because ideally, a lot of people would want to spend those last days at home surrounded by their loved ones.
Yes. We heard about Ronnie Corbett today.
Yes.
And if you ask many people, their priority is that they're pain-free, that they're with the people who matter to them, and that they're in a place where they feel familiar and comfortable. That might not be home, and actually 200,000 people are still going to die in hospital, so we need to improve the care there as well.
So you need to, but is it a little bit of a red herring, say care needs to be improved here, when actually a lot of people don't need to be in hospital anyway at the end of their lives?
Yes, we need to get people out quicker, and in order for that to happen, we need to have those conversations earlier to give people the possibility that they could leave hospital. But perhaps most importantly, we need to stop people going in who don't need to be there, who could be supported at home. So we need to support carers, family carers in a different way. We need to train nurses and doctors from the very early days. And I think there is huge opportunity for hospices and hospitals to work together.